Good evening and welcome to Talk Show on Cancer, an initiative by Integrated Health and Wellbeing Council supported by Roche. I'm Ridhi Lakra, Assistant Editor, IHW.TV. As we commemorate the World Cancer Day today, we are here to discuss the not much talked about the cancer care gap. With this year's theme, WHO emphasizes to strengthen health systems to prevent and detect cancers early, to provide prompt treatment referral, and also to enhance the access to palliative care, and to reduce the gap in the access to quality cancer services to all. To discuss more on closing the cancer gap and early detection and prevention, we have with us Dr. Jyoti Wadhwa. Dr. Wadhwa is Senior Director, Medical Oncology and Haematology-Oncology at the Medanta Cancer Institute. We welcome you, Doctor, for the panel discussion.
Thank you.
Doctor, firstly, we would like to start with a very important thing, that's the challenges. So what do you think, what are the challenges that lie in early detection? And what type of interventions do you feel would come over, it can overcome them?
A very important question. And I could sum up the three most important challenges to early detection of cancer as lack of awareness, access, and affordability. So there's a huge lack of access in our general public about cancer per se, about the risk factors of cancer, even the symptoms of cancer. So many patients present so late to us because they just couldn't think that it could be, that symptom could be cancer. Also, lack of awareness as to where to go to seek a doctor's advice. The availability of screening tests, they don't even know that it's possible to detect it early. And even when they don't have symptoms, they should and they could visit a doctor to see if they had anything suggestive of cancer in their body. The other most important challenge is the lack of easy access. Access to a hospital, access to a qualified doctor, since we still have a large population residing in villages, so this access remains a big issue. And third most important challenge, I would say, is the lack of affordability. Very few patients in India can afford undergoing the early detection tests or even the test to diagnose cancer, leave alone the treatment of cancer, which can be quite costly. So I think if we have to overcome these challenges, we'll have to raise the level of awareness in the society. We'll have to make cancer care accessible to a vast majority. And also we'll have to come out with steps that make cancer care more affordable. And I think herein would come the role of public-private partnership. Because, it's very difficult to provide the best possible cancer care alone for either sector, isn't it? Right.
Yes, Doctor. Dr. Wadhwa, when we talk about like the public-private partnership as well, there's something screening tests. So there are a lot of screening tests, even though there are like a lot of proper guidelines by the government and the WHO also gives us a proper guidelines for screen tests. But we see there is a low percentage that people go actually for cancer screening. And it is very low here in India. So what do you think we can make it better in a way?
Right, very well said. And you are absolutely right when you say that very few, hardly, if you take the amount of people that reside in our country, very few people undergo cancer screening tests as are recommended by various societies. So first and foremost reason for this low rate for screening of cancer is basically the lack of awareness. So we need platforms like the way you are doing today. This talk show, I think, will go a long way in raising this level of awareness about early detection of cancer with the help of screening tests. People will come forward, I think, after listening to us today, that yes, there are tests available to detect cancer even in asymptomatic individuals. So you don't have to have a symptom suggestive of cancer before you go and visit a doctor. So you could go even when you don't have any symptoms. If you fall in that particular category, screen category, then you must undergo those tests. Also, we need to tell people that besides those tests being available, what are those tests, at what age to undergo those tests, and how often to undergo those tests. So if we could tell them that, yes, all these things are there, they are available, and this is where you need to go, then I'm sure, with the increasing literacy and increasing level of awareness and education, they will definitely want to come forward and undergo these screening tests. But it has to be told again and again, I think, through various social platforms, the digital media, the print media will play a long, an important role in raising the level of awareness. We need to tell them that, if they undergo such screening tests and they are able to undergo an early diagnosis of cancer, then cancer could be cured. Because, when detected in early stage, the treatments are much better. The outcomes, the results of those treatments are much better. Patients live much longer and they live in a much better way. The quality of life is also then better. So all this is possible today, but by raising the awareness, I think a lot more could be done.
Dr. Wadhwa, you spoke about the early detection. So, we feel here in India, once the cancer is being diagnosed, any form of a cancer is once being diagnosed, but there's a huge gap between the detection and the treatment here in India. So, what do you think can be a very simple essential in the starting stage that we can tell about that this is an early detection and we have done this, and the next stage we can help people out in terms of the treatment? How can we close that gap?
Right. So again, a very pertinent question. And I would say that, first and foremost step, the initial step could be to make cancer a notifiable disease. So you'll be surprised to know that even though we talk so commonly about cancer these days, and we know that the number of cancer patients is huge, the number of cancer patients is increasing in India, it's very surprising that cancer is still not a notifiable disease. So a lot goes underreported. So what we actually see may be tip of iceberg. There would be a lot many more patients actually suffering from cancer than what are reported. So even though we have hospital-based and population-based cancer registries, but obviously the reporting is not complete. So cancer should be a notifiable disease, and the efforts are on, and some states have already made it a notifiable disease. The second step that I think would be crucial would be to address the three main issues which I've already enumerated, namely the awareness, access, and affordability. And in that, as I mentioned already, public and private partnership is highly desirable. And we need to involve various NGOs, the non-government organizations also, to be a partner with us in taking care of this huge cancer burden. And they are already doing quite a lot, but there's a scope for improvement. So these are some of the ways, I think, in which we could close the care gap for cancer patients in India.
I think that would be really great that, as you said, notifying the disease. And you said like a lot of states have already been doing that. And I think we need more studies on this, that there are these number of cancer within the states, and we can have more options for the patients as well. That would, I think, also bridge the gap between the treatment process and from the detection to the treatment process.
Yes.
Doctor, coming to the screening point, in India, like what are the different methods which is available for everybody for early detection of cancer in terms of what are the basic cancers, say for the breast cancer, the colon cancer, some of the major ones. So if somebody has cancer, how would they find out about these screenings?
Right. So these screening tests, they aim they are applicable to asymptomatic individuals. So when we plan to adopt a screening test, we have to ensure that that cancer is a big problem for us, for our population. So it is for, say, women in India, breast and cervical cancer are the two most common cancers. And fortunately, both these cancer sites are amenable to very good screening tests. So say, for example, breast cancer. So in breast cancer, breast self-examination. If a woman examines her breasts once every month, that's a good way to start. The women need to be aware, they need to be breast aware, so that if at all there's a change in future, they can pick it up quickly. The other test would be a examination of the breast by a doctor, and that could be done once in a year. And these things could start, at 20, as early as 20 years of age. All right. The most scientific screening test for breast cancer is what we call mammogram, or X-ray of the breast. However, that can't be done in very young people, because after all, it involves X-rays, and the breasts are dense in young women. So it may miss an abnormality. So mammogram has to be done, say, beyond a certain age, say 45 or 50, as the guidelines may deem right. So one needs to consider doing all these three tests: breast self-examination, clinical breast examination, and mammogram at the right age. For cervical cancer, we have very simple test called pap smear, and now it's combined with the HPV test, human papillomavirus test, because that's the cause of cervical cancer. So a very simple screening test, very easily doable. So once a woman becomes sexually active, one should undergo these tests, pap smear and HPV test. Then mouth cancer, it's a cancer which is very common and very peculiar to Indians. So the West will not come out with screening guidelines for that. We have to be proactive, isn't it? So a simple visit to a dentist should be, taken as an opportunity to undergo that simple examination of the mouth or the oral cavity, so that if there are any suspicious lesions or areas, they could be, brought to the attention. Then we have colon cancer. Both men and women, we have a test, endoscopic test called colonoscopy. So it is recommended that one could undergo colonoscopy after 50 years of age. So that's another screening test which is there in various guidelines. Lung cancer, the #1 cancer affecting Indian men. There is a low-dose CT scan of the chest. However, it is not recommended for each and every person. It is to be recommended in only high-risk groups, and that high-risk group is defined based on the age and the pack years of BD or cigarette, the degree or severity of smoking that a person has undertaken. So based on that, we define that high-risk group, and that high-risk group could then be advised a low-dose CT scan of the chest. Now coming to the most controversial screening test, and that's the serum PSA, which is a simple blood test for prostate cancer. So there was some controversy that, many more people underwent unnecessary biopsies and early, detection, wherein in their lifetime, they may not have actually suffered from the disease. So it has fallen into a bit of controversy. But earlier, this PSA test was recommended for men beyond 50 years of age. And all these guidelines are there in place. You just need to go and consult your doctor. And sometimes, keeping in view one's family history in mind. So if somebody has some members in the family who have already suffered from any of these cancers, one or some other cancer, like ovarian cancer or endometrial cancer or similar cancers, then one would modify the age for starting these screening tests. So go and visit a doctor, a cancer specialist, or a doctor like me, or sometimes, you don't even need a cancer specialist. Visit to a gynecologist, visit to a general surgeon is all that is required, to start the process of cancer screening.
Dr. Jyoti, you have in a very simple way, you have said, you have explained about all the various cancers that we can go for a screening process. Doctor, but coming to a very important point, we are here in India. This cancer screening is like a challenge, particularly in the rural areas. While we understand there is if the family also has a genetic problem that they are detected with that. But what do you think? What are the social implications and associated with the genetic testing, or overall the acceptance of cancer screening? And what do you think we can do to address this particularly?
Right. So coming to genetic testing, as you mentioned, that's also very important, especially knowing fully well that 5 to 10% of all cancers could have a hereditary or genetic basis to them. So keeping that in mind, it's very important to know about genetic testing. However, one thing I want to emphasize very clearly here, that before undergoing a genetic test for cancer, it's very important to undergo genetic counseling first. You need to see either oncologist or a genetic counselor, preferably, who would first talk to you as to what is the implication of doing a genetic test. You have to be mentally prepared to deal with a positive genetic test report, right? You can't just blindly go, hurriedly go get a genetic test done and then live with that anxiety for your life. You should undergo a genetic test for cancer only if you need to undergo it, first and foremost. And you need to be very clear as to whether you will act if the report comes out as positive. So meet a genetic counselor first, talk, discuss in detail, and only then undergo a genetic test. Now, coming to the other screening tests, as I said, and you said, how to address the stigma and the fear. So I would agree that there is a stigma still associated with cancer diagnosis. A lot of, taboos are still there. A lot of myths are prevalent in our society still. So I think education and awareness will go a long way in, getting over those myths and the stigma associated with cancer diagnosis. So we need to keep telling the general public that, there are these screening tests available. You don't have to have a symptom suggestive of cancer. You may feel perfectly normal, but you still, could be helped by undergoing these cancer screening tests. They are available. You just need to go and consult a doctor and then start only at the right age. Isn't it? Not otherwise. Everybody is not eligible for cancer screening test, right?
Yes, Dr. Jyoti, thank you so much for explaining that well. And I hope a lot of our listeners would also understand and not be scared about this very fact that if your family history does have a cancer, then you can go and before a counseling. That's a very important thing. Also, you also earlier mentioned that very simple one in terms of you can visit your dentist also in terms of the oral cancer. A small precaution what we all can take. Maybe if we are in a habit of chewing tobacco, that could be one of the reason to go to a specialist and address this issue.
Right.
Yes. And going further, when we talk about the research avenues, doctor, there have been a lot of research in terms of the screening in India, and it's been made of affordable and also accessible. And now with the new budget also, we hope that we will also see some new things in terms of the cancer as well. If you could share some insights about this, that what are the new accessible and affordable cancer screening here in India?
Yeah, so very affordable and simple tests I already mentioned, say for breast cancer, breast self-examination, clinical breast examination are very affordable. Mammogram machines, there are, mobile vans carrying mammogram machines, which we know, and they go into the rural areas also. And there are various NGOs already involved into doing this good work. And that's how it's being made accessible to even rural population. Now, coming to cervical cancer, the PAP test is very, very simple. And even the ASHA workers, in the rural India, they have been trained to carry out these simple screening tests like PAP smear, like doing breast examination, also doing oral examination. So what we are here and trying to do is utilizing the already existing infrastructure and the human resource. So we don't need to have hi-fi stuff or always newer machines or newer buildings or fancy stuff to be able to do the cancer screening. So if we can work on the already existing infrastructure, just train our already available staff a bit more, because even you don't need to be a doctor to be doing all this, right? So if we could train the men and women, like ASHA workers more, then it could be made more affordable and accessible. Also, you talked about the recent advances. So we know that in COVID era, we have all witnessed the increasing use of telemedicine, isn't it? So when the patients could not even come to the hospital, they could consult their doctor on their mobile phones, telephonically, or by video calls. So I think telemedicine can go a long way. So similarly, telemedicine can have different components to it. So what we can call teleconsultations, telepathology. Somebody takes a pap smear or a sample, a biopsy is taken somewhere and can be reported. A pathologist may not be seated there, but pathologist may be available at a distant location, many kilometers away, but could see the slide and give the report. So that's telepathology. Teleradiology, the mammogram has been done, but it's getting reported by a radiologist sitting in a metro city, many kilometers away, thousands of kilometers away. So that's called making use of the technology in a much better and more fruitful way. So I think that will also help in closing the cancer care gap and will take it a step forward.
Dr. Wadhwa, when we talk about the technology, you also might have come across some of the very newer technologies and which has benefited you in your work career and for the early detection. And now that you have been seeing, like, it's very simple, but yet very affordable and easily available. If you could share something on that lines.
So see, our oncology practice has undergone a sea change, a paradigm shift, as we call, over the years. A lot of advances have happened, and they have really improved the way we diagnose and treat cancers these days. So we have newer diagnostic tools, and we even have liquid biopsies. You don't always need a tissue sample, a piece of the tumor to diagnose and treat cancers. We have newer biomarkers which may be detected not only in blood, but also in, say, saliva or urine and some other body fluids also, to detect and plan the best possible treatment. One thing I want to say here is that, somebody in the audience might have heard of a newer test, which in fact the data was just presented a couple of months ago in our international oncology meeting. So there is a multi-cancer early detection blood test which is under development, and this could detect a common cancer signal for over 50 different types of cancers. And this could then tell where these abnormal signals are coming from, just a simple blood test. So basically what it's trying to detect is a small sequence of circulating tumor DNA. The basis of our body functioning, the cell and the nucleus within it containing the genes or the DNA. So by detecting that circulating tumor DNA in the blood sample, one could detect even those cancers. In future, we hope that we may be able to detect cancers which are currently unscreenable. But I would emphasize here that a lot more research work needs to be done in this direction, and we need to gain, larger experience. Larger number of samples need to be studied before we could, apply it to general population. So a lot of action happening in the oncology circuit these days, basically trying to improve the outcome of cancer patients.
Thank you so much, Dr. Wadhwa. Coming to the end of our talk, I would like to ask a very important question. Doctor, how would you inspire people to take cancer screening very seriously in a society and tell people that, yes, we need to go and take proper screening and test ourselves?
Right. So you have saved the best and the most important question for the last. So I'm sure everybody knows that early detection is the key to surviving cancer, isn't it? So if you want to beat cancer, if you want the cancer to be cured, you have to pick it up early. There's no doubt about it that early detection will save life. And early detection, in fact, is the strongest weapon that's available to us today to win the war against cancer. So if you want to do early detection of cancer, then the only way is screening tests, because we use screening tests in those patients or those individuals who are not yet patients, and they don't have any symptoms. So that's the aim of screening tests. So if you are convinced, then you would contact a doctor. And screening tests, when offered to the right individual at the right time, they do help in diagnosing cancer at early stage, and therefore they result in better treatment, cure, and better outcome. So by doing this, we not only prolong the life, but also we improve the quality of life. The remaining life is not ill affected by the cancer treatment. It will be less disfiguring, less of side effects, could be managed just with a simple operation or surgery. You will not even need then maybe chemotherapy or similar drugs. So it's good to undergo cancer screening to save lives. That's what I want to tell all the audience.
Thank you so much, Dr. Wadhwa, for this inspiring thing. Yes, and I hope after listening to you, a lot of people would actually understand what is cancer, and yes, go for the screening process and start taking of their health at a very early stage. And I would like to thank everybody who's joined here for listening on this Cancer
Just
Day.
one last sentence, if I could add, to tell everybody that don't be fearful of cancer, be hopeful, because the treatments have really advanced now. So we tell all this not to scare you, but to instill hope. That's the aim. At least that's my aim, to tell you that a lot is possible now. We are in the year 2023, and a lot can be done to help our cancer patients. So be hopeful, not fearful.
Yes, let's all be hopeful and not fearful. And as you said, we can beat cancer only when we have an early detection. And I hope with the newer technologies and the advancement, a lot of people would get early screening. And yes, the process of treatment is also going in an advancement. We would have much better outcomes for the cancer patients. And I would like to thank everybody who has joined here. And on behalf of the ISW Council, I would like to thank Dr. Jyoti Wadhwa for joining us and talking about cancer, and Roche, who has taken a special initiative on the Cancer Day to talk about this. And yes, through this, we are bridging a gap about a lot of other things, maybe the new cancer screening, the treatment options. And we'll be discussing about this in the future as well. Because cancer, we do not discuss cancer only one day, it's an everyday thing. And yes, there are fighters who are surviving, and there are good doctors like you who are working hard to help people. Thank you so much, everyone. Have a good evening.
Thank you for having me. Thank you.